Okay, welcome to the Healthy Back Plan mini course. I'm super excited that you've chosen to join this Facebook group and be part of this community. And this mini course is going to teach you so much about recovering from back pain, why you have certain symptoms, how to overcome them, how to target the symptoms of pain, but also the root cause of your pain, and strategies that you can use to effectively overcome your pain and burn fat in the process. I'm going to introduce who I am in this video, my own journey to recovery from back pain, and the most effective system that I've found to recover from back pain, and how I might be able to help you restore your own back health, burn fat, and reclaim your life. So let me take you back to 2019 before my journey with back pain started. Life was going pretty great for me. I had a lovely girlfriend at the time who's now my wife. I did lots of activities with her. We'd go for walks, go hiking, play sports, enjoy family gatherings together. And I was in pretty good shape. I had good confidence. Everything was going well for me until it didn't. I remember vividly one morning out of nowhere, waking up with excruciating pain in my back and down my leg, unable to get out of bed, unable to walk. And on screen is the actual MRI scan that I had from the hospital, where you can see, and it's highlighted in green, that I had a herniated disc. And not only that particular disc is darker than others, suggesting that it was also degenerating too. And sure enough, the hospital reports confirmed what I was feeling. The specialist report confirmed degeneration of my L4, L5 disc, herniation of L4, L5, bulge of L3, L4, and also some bulging of L5, S1. And that's not all. A subsequent scan confirmed that I also had mild scoliosis. And the specialist reports confirmed that I also had a lateral pelvic tilt. So there I was in a world of pain, and then everything that brought along with it: loss of energy, increased levels of stress, problems with sleeping, anxiety, and dreading day-to-day activities, increased weight gain, feelings of hopelessness, unproductive coping mechanisms such as overeating, irritability, and so on and so forth. And I'm pretty certain that some of you watching this will have had some of these symptoms also as a byproduct of your back pain. And it all came to a head when I was at my lowest point. I put on lots of weight, 48 pounds, experienced symptoms of depression. I didn't feel like going out. I remember one time rejecting one of my friends inviting me to go out with him and his girlfriend, along with myself and my wife. But I rejected that, not because I didn't want to go, but I was actually in too much pain. I knew that if I went to that particular event, I was just going to be in a world of trouble. And ultimately, I felt like I had an invisible disability. My friends didn't understand. My family didn't understand. I lost my mojo, and back pain was just crushing me without anyone really realizing. And I feared that I wouldn't be able to play with my future children how I wanted. I was angry and bitter that I couldn't do what I used to do and was becoming someone that I never wanted to be. So I played by all the rules and tried everything you're seeing on screen. All of the doctors, chiropractors, and therapists, they didn't understand the sleepless nights, the tears. I felt like I was getting scammed into coming back to appointments after appointments with no noticeable improvements. And some of the strategies, yes, they had their benefits, but what I found is that they all had uses and benefits, but not any one in isolation worked on its own. It required a combination of the best of each to recover and thrive, and doctors couldn't fully empathize. To them, I was just a number with a goal of just giving me some pills and sending me on my way. And there was no plan to recover mentally, physically, and strategies and mechanisms to deal with the pain, but also the harmful negative coping strategies that we often turn to when we experience pain. So I got to the point I was in all out survival mode. I didn't want to resign myself to the fact that the life I enjoyed and knew I could enjoy it was going to be over for me because of my back pain. It was now me versus my back pain, and I wanted to win. So I spent countless hours researching the best practices from lots of different recovery disciplines, looked at all the research for myself, tried various treatments, and ultimately found that a multidisciplinary approach, which I like to call the healthy back plan, is the most effective way to recover from back pain and burn fat in the process. A program that will focus on each of the key areas of recovery: physical, psychological, diet, sleep, understanding pain science, understanding the ugly truths of the back pain industry, and recovering from the mental trauma of an injury. And I had great results with what I found to ultimately work. Look, I get it. Not everyone wants to be an ultra ripped or shredded fitness model, but for me, I wanted to take it this far. I wanted to kick back pain in the butt and show that it had no hold on me anymore. Some people just want to get their movement back. They just want to be able to play with their kids, do daily activities, go to work without pain, and so on and so forth. But I managed to find a structure and a program to improve my pain and train around my injuries without hurting myself. So I managed to get in the best shape ever. And I wanted to draw a line in the sand, kick back pain in the butt, learn to deal with my flare ups, and get in great shape in the process. And as a result, I was able to return to activities I like doing. actually laugh, love, and enjoy life again. I didn't have to worry about pain surfacing, not being able to manage it. I could actually walk more than 20 meters without having to stop and sit down. And all of my friends and family commented about how the old Justin was back, although I knew this time I'd grown as a person having beaten back pain. See, the old way of only doing single treatment methods often only provides temporary relief and target symptoms, but not the root cause of pain. I found I had endless appointments with doctors, chiropractors, and other specialists only to be given some painkillers to mask the pain or have some sort of treatment that only addresses the symptom, but not the root cause of my pain. And oftentimes, unrealistic exercises or stretching programs to follow that I couldn't even start off to begin with because I was in so much pain and I couldn't even do the ones that they were suggesting. And because these single treatments only provided some relief to the symptoms, I still feared going out. I still feared certain movements, doing certain activities, and having constant flare ups. And this led to being stuck in what I called the cycle of back pain. And I was losing hope and beginning to doubt whether I would ever truly recover. Now, compare this to, as I mentioned, the new way, which is a multidisciplinary method. A multidisciplinary approach to back pain involves integrating expertise from various fields, such as physical therapy, psychology, diet, sleep, nutrition, and other alternative therapies to create a holistic, comprehensive treatment plan tailored to you as the individual. It aims to address not only the physical symptoms, but also the emotional, social, and lifestyle factors that may contribute or worsen the condition. But don't just take my word for it. Let's look at some of the scientific evidence together. The 2015 Cochrane review into multidisciplinary rehabilitation programs for back pain involving 41 trials found strong evidence that multidisciplinary programs integrating psychological and physical therapies outperformed usual care and physical treatments alone in reducing pain and disability for chronic lower back pain with lasting benefits. A 2012 prospective study by Moorfield of 395 patients showed that a 3-week multidisciplinary treatment program for chronic lower back pain significantly improved pain, function, and quality of life, outperforming monodisciplinary treatments, single treatment methods. And 80% of patients sustained these gains as 6-month follow-up, compared to only 30% in historical monodisciplinary single treatment method groups. The 2001 systematic review by Guzman, analyzing 10 trials with nearly 2,000 patients, found strong evidence that intensive multidisciplinary recovery programs significantly outperform non-multidisciplinary treatments, improving function and reducing pain by 20 to 30% more than usual care or monodisciplinary outpatient approaches for chronic lower back pain. It starts with a clear assessment of your movement ability and pain triggers. And this is going to be specific to you as an individual. There isn't a cookie cutter program. That's why these top 5 stretches that you need to do to fix your pain. Yes, those are helpful and we'll get onto those. But there also has to be a clear strategy for you as a specific individual with your specific range of motion, your specific pain triggers, and ultimately what we need to work on to get you out of pain. Not a blanket program that will work for everyone, because that just isn't the case. And that's not the most effective way to recover. A clear, actionable, and management plan to eliminate back pain for good based on your circumstances with a variety of treatment methods, often involving targeted exercises to fit your current level to rebuild strength and fix pain. Nutritional strategies to reduce inflammation, enhance recovery, and give you energy, and mental tools and frames so that you stay motivated, make progress, and fight the harmful psychological effects of back pain. So you ultimately regain control of your situation, restore confidence, and improve your symptoms and burn fat in the process. So now this comes down to you and your journey with pain and your commitment to beating back pain. So you have to ask yourself, what is it that you want to be able to do? Who is it that you want to be? What activities do you want to be able to enjoy again? And do I really need to change my situation? Do you have a sense of urgency that you actually really want to change your situation? Or are you someone that is just happy being where they are? You're happy being on the couch, not being able to do the activities that you want to do, not feeling how you should be feeling, and so on and so forth. And who else am I going to be doing this above myself? What else is going to be motivating you apart from your own motivations? Do you want to do it for your spouse, your kids, your family, or your friends? So I need to set some expectations and my commitment to you in this course. I'm going to give you the framework that I use to turn my life around, beat back pain, and burn fat, give you clarity on the next steps to improve your situation, reduce all the noise and focus on what actually works, empower you to start the process of change and your own journey, and share with you my best strategies and pitfalls to avoid when rehabilitating your back pain and achieving your fitness goals, and leave you with an actual game plan moving forward with actions that you can take from today to improve your situation. Now, this is what I need from you. I need you to limit your distractions. Put your phone on do not disturb. If you're watching this on a laptop or a PC, close the other browser tabs and just focus on this as much as possible. Stop scrolling in the background, get out your notebook and take notes and follow along, and focus on this specific moment. You are where you are. You can't change the past, but it's time to draw a line under the sand and work towards a better future. Imagine the possibilities of a life with reduced back pain and a better physique. Allow yourself to be open to change. Be open to a change in mindset and self-reflection as well. And make sure that you have continued effort beyond this course. There's only so much that I can give you in this time together. You can read the book that I wrote. You can keep learning. Maybe you'll choose to work with me after this course for an extended period of time to get more one-on-one coaching and support. But it can't stop here. Now, there are some things not to expect in this course as well. I'm not going to be able to give you specific medical advice for your situation. I've not spoken to you. I'm not a trained doctor. I'm not a surgeon. This is purely anecdotal and for entertainment purposes. I have to say that as a disclaimer. I'm not a licensed physician, and I'm not promising that I can help you cure your pain completely. But I do 100% believe that you can improve from where you are today using these strategies. Even a 25, 50%, 75% improvement is better than a 0% improvement. The reality is there's no single magic pill I can say to give you. I'm not going to suggest you hop on pills or take surgery, and this does require some work. It's not necessarily your fault that you're in this position with your back pain, but it is your problem. So we need to tackle this with a proactive solution to help you get where you want to be. The sooner that I accepted where I was and the position that I was in, the quicker I was able to forgive myself, move on, and start improvement. So if you're ready to get started and make a change, make a commitment today that you're going to watch the entirety of this course. You're going to take notes. You're going to be proactive, and you're actually going to implement what it is that I teach you. You're actually going to give it a go. You're actually going to try. And you really need to make a commitment to yourself that you're going to draw a line in the sand and make a change. But before we dive in, I need you to learn some truths. This is important because if you don't understand and learn these truths, it makes recovering from back pain a lot harder and prohibits you from allowing yourself to recover. So follow along in the next video where we're going to dispel some common back pain myths.